Hello, my name is Stephanie and I'm a nurse in the surgery department at Rush Memorial Hospital, and today I'm going to talk to you about your knee arthroscopy procedure. But first I wanted to say thank you very much for choosing Rush Memorial Hospital. We are committed to the success of your surgery and the exceptional care and customer service that you are going to get today. Today we're going to talk about what to expect when it comes to surgery and the whole day. First we'll talk about what to expect before your surgery, during your surgery, after you go home, and then follow-up care after that. What to expect when it comes to before surgery. Surgery will be scheduled in the office and they'll give you a date. They'll tell you any medications to hold that day. There will be some medications that you take regularly that will want you to not take either the day of surgery or up to 5 days before. The surgery department will call you later to confirm and give you a time to be at the hospital. You'll come to the main entrance at the emergency room, and then someone from the surgery department will come down and pick you up and bring you up to your pre-op room. Once you get to pre-op, you'll get an IV started, and then after we're ready, we'll take you back to the operating room. Once you get back there, the anesthesiologist will give you some medication to help you fall asleep. Dr. Ginther will then perform the surgery and afterwards take you to the recovery room to help you wake up. After you wake up and your vitals are stable and everything's fairly back to normal, you'll go back to the pre-op area where you'll stay for a minimum of 1 hour after your procedure and then be ready to go home. You'll go home with a large ACE wrap over your knee, and it looks like this here. That ACE wrap will go from your mid-thigh down to your ankle. After you get home, you leave the large bandage on all day, and before you go to bed, you'll take the large ACE wrap off and replace it with the smaller ACE wrap and the 4x4 gauze that we'll give you before you leave the recovery room. The smaller ACE wrap looks like this. It's a lot shorter on your leg and it'll be easier to move around in. When you unwrap your ACE wrap at the end of the night, you will find 2 small pieces of yellow gauze over your incision sites. Those are called zero form. Those are there to help protect your incisions. Leave those on. If one of those does fall off, it's okay. You can just leave it off. Put the gauze back on and then rewrap with the smaller ACE wrap. The little yellow pieces of gauze look just like that. Before and after you change your gauze, make sure that you wash your hands and keep the site clean. Make sure you don't touch it. That's why if the zero form falls off, you can just leave it, place the new gauze on, and then rewrap with the smaller wrap. Some things to watch for after surgery. Their bloody drainage is normal after surgery. It will be a red, light red to a pink, and that's okay. After the first day, that should start to lighten up. If it gets darker or increases in amount, please make sure to call the office. Stiffness, swelling, and pain are all normal after a knee arthroscopy. So don't be surprised if your knee feels tight or stiff after you go home. You can put your full weight on your leg after you leave. There's not normally a need for crutches or anything of that sort. For the first 3 days, make sure to take it easy. Go home, ice, rest, and elevate your leg. That is going to feel the best for you once you get there. From day 4 to 7, you can do activity for up to 1 hour at a time. After that, make sure you rest, ice, and elevate as well. And after 2 weeks, you can walk on your leg as much as you can tolerate. Complications and pain control. Complications with scopes are very minimal. If you start to have swelling, pain, or redness in your calf, please call the office immediately. If you have shortness of breath, you're coughing up blood, or chest pain, make sure you get to an emergency room as quickly as possible. If you have any fevers or notice a foul drainage coming from your wound, Make sure that you call the office as quickly as you can. That can be a sign of infection, and we want to get on top of that as soon as possible. Keep your knee elevated above your heart, and keep ice in your compression brace on the knee when you can. You may go home with a Coreflex brace and an ice pack. This helps with the swelling and pain after surgery. The ice pack in the brace is removable. That goes in the freezer. The rest of the brace stays out. You can keep ice on your knee for 20 minutes every hour as needed for pain and swelling. Okay. Common questions after surgery. How long will you be in pain? Usually pain is the worst for the first 24 to 72 hours after your surgery. Ice, rest, compression, and elevation are going to be your most helpful tools to help get rid of that pain. How long until I can resume my normal activity? Recovery depends on your age and prior activity level. Decreased activity usually does contribute to a longer time for getting yourself back to normal. Your best bet for recovery is to really try to get up and moving as soon as you can. You're usually back to normal after 4 weeks. Do I need crutches? Patients typically don't need crutches after this procedure. You should be able to bear your full weight on your leg once you leave. Do I need physical therapy? Not usually. People only need physical therapy if it's recommended by their physicians. But getting up and walking and doing your normal activities for short periods of time should be just fine. When can I drive? You can drive after 24 hours from your surgery, and then if you're not taking any narcotics. So if you do go home and you are taking your prescription pain medication regularly, you can't drive while you're taking those. Do I need to keep the sutures dry and clean? Yes, you can purchase waterproof Band-Aids if you need to, or you can use saran wrap and wrap your leg in saran wrap in order to take a shower. I am not wearing a mask today because we are practicing social distancing in the room we're filming this video. Thank you so much for choosing Rush Memorial Hospital to have your procedure, and we'll see you soon.
Rush Memorial Hospital, committed to you, close to home.